Hello, I'm Dr. Samantha and I'm a naturopath that specializes in fertility and hormone health, and today we are going to talk about early signs of pregnancy. Hello, and welcome back to my channel. Today we're going to talk about early pregnancy signs, but before I get started, don't forget to hit the subscribe button. We come out with a new video every single Friday about hormone health and fertility care. When trying to conceive, there's a window called the 2-week wait that can be a really hard time because you're waiting to see if pregnancy did occur during this cycle. At the end of the day, the 2-week wait is probably always going to be something that's a little bit difficult. I do want to say that everyone experiences different signs, different symptoms. I'll probably say that a lot actually throughout this video, but these are just some things that can lead you down the path of, maybe I'm pregnant. So before we get started, let's just do a quick review of the menstrual cycle. Again, I talk about this a lot in other videos. I'll probably make a more detailed one, but let's just start with, the first half of the cycle. It's called the follicular phase. This includes your period and then the time leading up to ovulation. Ovulation then occurs around the middle of the cycle if we're basing it off a 28-day cycle, which don't worry, it's okay if you don't have a 28-day cycle. It's completely normal still. Ovulation tends though to take place around day 14 in that 28-day cycle. So we have your period, usually that can last anywhere from 3 to 5 days. Then we have a period of time where our endometrial lining is building up again, and then all of a sudden we ovulate. That's when an egg is released. That's what we need to happen in order to conceive. And then after that is the luteal phase. The luteal phase is that second half of the cycle. It comes after ovulation. This is the time where a lot of progesterone is being secreted from something called the corpus luteum, which is left over after the egg is released. So those might be a lot of long terms, but that's just to kind of give you an idea of what a cycle looks like. So we talked about follicular phase, ovulation, luteal phase. So we talked about progesterone and how that's secreted during the luteal phase. What are signs and symptoms of that progesterone? Many people might see some slight nausea. Sometimes that doesn't happen all the time. Constipation, mood irregularities, breast tenderness, some back achiness, and some headaches. However, if you're getting headaches often, that is something that I do usually recommend getting worked up. That might be more of a hormone imbalance issue that we need to work through. The reason why I'm sharing signs and symptoms that might go along with progesterone is because a lot of them can mimic early signs of pregnancy. Sometimes there's just a slight difference in the signs and symptoms that you may experience. So what are going to be the different symptoms that come with early pregnancy? Again, you might not experience any of these. Honestly, your cycle might feel the same. There's a lot of variables up in the air here when it comes to early pregnancy signs, but these are just some that can hopefully give you a little bit of guidance in what to look for. I do often find that a lot of people end up looking back and say, oh yeah, those were definitely different symptoms than I usually experience during my luteal phase. So first we're gonna go with signs of implantation. I actually made a video on this a couple weeks ago. I'll link that below so you can kind of check that out. I just talk about them in more detail than I'm gonna share here. So essentially it's gonna be slight cramping before the time that cramps occur for your period, possibly some light implantation bleeding. Usually this is more of like a light pink watery consistency bleeding and should only last for a very short period of time, whereas a period obviously is going to last a lot longer. So basal body temperature in pregnancy will actually stay elevated. With that being said, sometimes during early pregnancy, we'll see basal body temperature increase a little bit and then decrease just a little bit. It will still be over the ovulation line that occurs in all of your apps and stuff like that, but it will decrease a little bit and then go back up again and then stay up consistently, honestly, throughout the entire pregnancy. So that's something that you can look for. We also see increased cervical mucus. Definitely nausea can occur. This is even more so than just with progesterone, right? A lot of fatigue. Fatigue is a big one. A lot of times, if you feel fatigued just during your cycle, definitely get that checked out. But pregnancy and fatigue definitely go hand in hand. Sense of smell changes. You're more sensitive to smell. Appetite and foods you like all of a sudden start to change. Darkened areolas, frequent urination, bloating, constipation can occur. Like we said, with progesterone, also constipation can occur, but sometimes this might be a little bit more prevalent and then obviously lasts beyond just the 2 weeks of that luteal phase. Dizziness, nasal congestion, and obviously a skipped period. So those are some of those early signs and symptoms. You might experience all of them, you might experience none of them, you might only experience some of them. they might overlap with the symptoms that you feel in general in your luteal phase. But again, this video is just to educate you on possible signs and symptoms that you can look out for. A little reminder that if you are using exogenous progesterone, so progesterone that you didn't make for yourself, so like a pill, a patch, a troche, suppository, and so on, that you may experience some of these symptoms while you're using that, because we're increasing your progesterone a great amount, a big amount, and that can lead to false like early pregnancy symptoms. So I just wanted to let you know that. In addition, it can also extend your period. So if you feel like all of a sudden your period seems a lot longer, it could be due to the fact that you are taking that extra progesterone. One other thing is a lot of people who are going through fertility treatments, obviously you're probably watching this video, and if you have an HCG trigger shot, again, that can do the same thing. And because HCG is now in your system, it actually can give even a false pregnancy test. So if you're getting those done, I would highly recommend waiting to get a pregnancy test done until your clinic has said you can. But besides that, those are early signs of pregnancy. Again, it can be different for everyone. You can have all of them and possibly be pregnant. Unfortunately, we don't ever really know until we start doing those tests, including that blood serum test. That's going to be the most accurate. But this all leads up to the question, when do I actually test? So we have a lot of tests out there, a lot of different options. They're all pretty good nowadays, but some say you can test earlier than others. At the end of the day, you know, testing after your missed period is going to be the most accurate result. However, I do know that the 2-week wait can be really challenging, and some people just want to test before. Even if you test before, you still might be pregnant if it doesn't show up. A lot of times there are faint lines, but again, if you are testing too early, you might have a false negative. So that's something to remember. If you're going to be testing a lot, I highly recommend getting those little strips that kind of look like ovulation predictor strips. Those are really helpful and can save a lot of money, but you know, you can totally buy whichever test feels comfortable and right for you. Like I said, they're all pretty good nowadays at picking up that HCG. Ultimately though, these are some early signs and symptoms of pregnancy. I hope this video was helpful, and I hope you got to learn something new today. Please give this video a thumbs up if you enjoyed its content, and don't hesitate to ask any questions in the comments. I will do my best to get back to you or create a new video based off your question. But thanks for being here, and have a beautiful rest of your day.